All right. Welcome, everybody. Well, at least you're close to me. I'm in Las Vegas. Oh, nice. Yes, I'm in Los Angeles. All right. How much to replace breast implants? It depends on exactly what we're doing. Are we taking out, putting new implants in? Are we tightening the cleavage? Do you have a capsular contracture? Are there other issues going on? Replacement and revision of kind of the chest implants sometimes can get tricky because there could be more than one or two things or multiple things going on. I would say if it's a simple, just in and out type of thing, and maybe clean up some things, maybe 10 minor over the muscle. If it's already over the muscle, and again, it's very, very minor. And again, our definition of minor can be different. So I would say 10 to 16, 18, something like that. Again, depending on how simple it is. Most patients think it's simple, and then when you actually look at it, it's actually more complex than you think. So, oh, I got restricted already. Eating disorder, risky weight management, and body image. I didn't say anything about eating. We talked about chest implant replacement. That's weird. TikTok is being very weird lately. I don't know what's going on. I might have to, like I said, sign off of here and get back on. So I apologize about that if we have to do that real quick. But let me answer the last few over here. What should I do for acne, bro? Use everything, please. What's the reason? Go see a dermatologist. I'm a surgeon. That's going to be more of a dermatology situation. So I'd ask them. Yeah, you might have to restart. TikTok's very sensitive. Yeah, I mean, I literally gone on not even a minute, and they already banned me. So, very, very strange. 3 restrictions. How do I have three restrictions? Wow, less than a minute. 3 restrictions. Okay, cool. Well, let me. Okay. Well. Okay, well, let me get off and try to get back on then. What the hell, yo? All right, guys. Sorry, I'm back. Just trying to figure out the TikTok situation here. All right. Welcome, everybody. We're going to try this one more time. We changed some settings on the TikTok live, so hopefully we can hopefully it won't restrict us or anything like that. So we're gonna give this a try again. We'll give it a minute for everybody to join on. So welcome, everybody. My name is Dr. Roger Tsai. I'm a board certified plastic surgeon in Los Angeles and Miami. Yeah, this is basically a forum for the next hour from 1 to 2 o'clock Pacific Standard Time. I'm going to kind of chat with you guys, and you guys can ask me any questions you want about the health and beauty industry. And we can kind of talk a little bit more about that, answer any questions that you guys might have about that, and then kind of take it from there. Okay, so I am on TikTok, YouTube, and Instagram here. So let me actually get started on Instagram here. All right. Welcome everybody from Instagram. We're going to get started here. My name is Dr. Roger Tsai. Again, I'm a board certified plastic surgeon in Los Angeles and Miami. We're just going to wait, give it some time for everybody to kind of join on. This is a 1 hour kind of forum or a session to talk about anything you guys want to know about plastic surgery, about what I do, any questions you guys might have about surgery or the beauty industry or anything that I do. Hello, hi, Shank1Official. Thanks for joining. I am on Instagram, TikTok, and YouTube, so all these channels, and we'll give it a minute for everybody to join in. But I do work in Los Angeles and Miami. The link tree in my profile is going to be a good resource for you guys to take a look at. There's a lot of before and after photos on there, a lot of educational information that we've kind of curated, a YouTube video channel that has a lot of consultation videos, and so on and so forth. So a lot of good information on there. Okay, I can't stand my double chin. I already had lipo. Should I get a neck lift? Well, it depends on what the double chin is. Is it volume or is it skin, right? If you already had lipo there, it's most likely skin, and you probably would need to get a neck lift. But do understand, neck lift will take care of the skin, not volume. So we got to make sure the lipo was done well, and then it's not truly volume, that is truly skin. If it's truly skin, then yes, you can get a neck lift, but we just got to double check and make sure there's no volume left in there. Okay, so that's the most important thing. Is it just volume or is it just skin? And so on. Okay, great. All right, we'll give it. There we go. Thank you. My pleasure. Where are you located? I'm in Los Angeles and Miami. General and sleep apnea. I don't use a CPAP. Good for you. I don't know much about CPAP. Oh my gosh, I'm getting banned again. Let's see. Submit feedback. Yeah, it's not that. I'm sure why I got restricted yet again here. But no worries, we'll try to keep this going. I might have to reset the TikTok again, but no worries. I'm working out Monday to Friday. Can't seem to get rid of my belly fat. Any suggestions? Peptides. I just started doing a new round of peptides last week. They seem to work, pretty well. It's not gonna replace diet and exercise, but it can help get you to the next level. As we get older, our metabolism slows down. Maybe the food that we eat sometimes isn't the healthiest, and so peptides can help us, get to that next level. So that might be something I would look into. How much downtime for brow lift and upper bleph? A week to 2 weeks. Hey, my surgeon canceled my tummy tuck because of a small 2 centimeter hernia. As that means I can never have one done? No, you can have one done. I mean, generally, most surgeons can fix it, or they just call in a general surgeon to come and fix a hernia. I mean, it's kind of they should have told you before, kind of, booking a surgery. So I mean, having it canceled is not good business practice, I would say, but to each their own. I mean, if you knew you had a small hernia, why book it in the first place if you wasn't going to do it, right? So sounds a little fishy. 2 centimeters isn't that big. It's only that small. I mean, that most surgeons can repair that. What is the record of nose jobs you have done on one patient, and were they blonde? Not sure why the blonde has any relevance, but I've done, not me, by the way, not that I did all of them, but I had a girl that came in from Las Vegas who had her nose done, I think 4 times before, and I did the 5th one for her, and finally fixed it. So yeah, I was a 5th one that did it for her. But you know, it depends on the situation. Thoughts on upper left? I think it could be great for the right patients. It could be great for the right patients. Helps open up the eyes a little bit more. Makes you not look quite as tired. So I think, again, good for the right patient. What to do if build chest muscle but breast part tiny bit of saggy skin? I'm not sure what you're saying there, Rob Kern. Are you talking about an implant? I'm not sure exactly what you're saying. You have to re-answer that question. Answer that one. What is peptide? I heard so much about it. Peptides are basically these injections that you can do. It's basically like a protein, amino acid protein, basically, that you can inject, and it stimulates your bodies to do certain things. For example, there's anti-inflammatory peptides. There's peptides that stimulate growth hormone. There's peptides that stimulate fat burning, stimulates metabolism, things like that. So, basically injections, supplements, kind of, that you can do that will help regulate certain chemical processes in the body. They kept my money. Well, there's obviously some scammy thing going on there. I'm not sure who you went to. That's why it's very important to make sure you go to a board certified plastic surgeon and a reputable business. Anesthesia and sleep apnea dangerous? Not necessarily. It depends on how bad the sleep apnea is. The thing about anesthesia is you usually have a tube in your throat. So there's a tube that goes through and prevents your throat from closing up. So generally it's not an issue. But sleep apnea can cause other medical problems, right? And so that's something you'll need to get what we call a medical clearance on. You'll go see your doctor and they'll tell you if you're okay to proceed with surgery or not. Right, slightly loose skin on the chest. You might need skin tightening procedures. You might need like a chest lift. It really depends on, oh crap. I didn't mean to invite somebody, but which peptide should I get on really belly fat? I think there's something called AOD. I forget the exact numbers, and then there is another one, growth hormone stimulant. Sorry, I don't know what happened there. Okay. Where to safely get it from and what's the cost? It depends. I have a lab that I get it from specifically. But you kind of have to be local here because I get it from a local area here. But it depends on where you're at. I mean, you have to talk to a doctor to get to kind of understand, because the doctors kind of physicians usually know FDA facilities and places that can create these peptides that are more legitimate, if that makes sense, because there's a lot of gray market and non-legitimate peptides out there. So you kind of have to find somebody somewhat local, if that makes sense. Okay, thank you. My pleasure. All right, I am going to sign off on the TikTok and try to get back on because I got banned yet again. So those of you that are on TikTok, give me a sec. I'm gonna sign off and kind of get back on and see if we can see what's going on here. All right. Let me sign off here. TikTok's being super annoying. Okay. Great. All right, Trish Kings, good to see you again. Hey, officially 2 weeks. Very swollen, but I see the vision. Thanks to you. My question is, when will a noticeable swelling come down? 1 month to be presentable. 1 month to presentable, so you're basically about halfway there. And then about probably close to 6 months before you see the final results, around 6 months or so. But 1 month to be presentable and 6 months or so before it's kind of the final result type of situation. So 2 weeks still very early. It should be continuing to get better and better as time progresses. Yeah, it'll take some time, unfortunately. All right, we're back on TikTok there. Yes, also, what's up? All right. All right, back on TikTok. We'll give it a few minutes for people to join in. Hopefully they don't kick me out again, but we'll see. How much is full TT? It's about 12 to 15,000, depending on kind of the situation. If it's kind of just only skin, or do we have to do an extended one, or so on. When does the bleeding usually stop from rhinoplasty? I would say the majority, probably 2 or 3 days. You might have some spotting for even up to a week, but for 2 or 3 days after that, it's like clear blood. It's just diluted blood because you probably have snot and mucus and things like that mixed in with the blood. So usually, at least 2 or 3 days. Again, maybe spotting by the time you hit about a week, but it can take some time. All right. Still waiting on some TikTok to pop in here. Okay. So now that we have some time here, I'm going to talk a little bit more about peptides, and somebody asked about that. So, peptides again are, these little peptides are basically amino acids and stuff that you can inject. Basically, there's a protocol for these. It's pretty much an everyday type of situation. 5 days on, 2 days off, 5 days on, 2 days off, depending on the type of peptides that you're using. Just anti-inflammatory peptides. And all right, let me answer this first. When can I start sleeping on my side? Stop wearing the surgical bra. Keep wearing the surgical bra until I see you, basically in clinic in like 2 or 3 weeks when I'm down there. And you can start sleeping a little bit on your side, not all the way to the side, but like maybe 45 degrees like that. Not all the way to the side, but you can lean towards one side or the other, but not all the way quite yet. Okay. Oh, if I talk about that's why. Okay. Thank you, Gabby. I appreciate that because I'm not sure. Okay, yeah. TikTok is funny. Sometimes there's things that you can't talk about. So thank you for that. You're probably correct. I mean, I can't talk about that again, or else I'll get flagged again. You're right. Appreciate the heads up, man. Yeah, I guess you're limited. I don't know why. It's not like it's anything back. It's less potent than surgery, so it's kind of funny. Weight loss, gotcha, because it has to do with weight loss and body. Okay, I gotcha. Thanks for the heads up. That was nice. I've had 3 capsulated implants. What can I do to stop this from happening? I would say if it really bothers you enough, well, the first thing I would do is change plane. So if you're under the muscle, I'd go above the muscle. If you're above the muscle, I'd go under the muscle. Okay. Then I would switch to maybe Motiva implants. Then I would probably switch to, consider putting cadaver tissue in there, whether it's human cadaver skin or pig cadaver skin or something like that. If that doesn't work, then the best thing is to explant, take it out, let your body heal whatever's going on, let it recover, and then come back and fight another day. I mean, I hate to say that because nobody wants to if you have implants in, nobody wants to take them out and, live with that for, 6 months to a year before putting stuff in. And so, that's the route I would go. Again, change out the implants, change the pocket, think about placing cadaver tissue, and that hopefully should take care of it. How come some surgeons tell patients not to wear compression socks during and after surgery? I don't know. I have my patients wear it. It really depends on, do they have the machine that squeezes your legs during surgery to prevent, blood clots? If so, compression socks may not be necessary. If the procedure was only an hour or less, you might not need to have the compression socks. So it really depends on the situation, I would say. Is skincare really that important? I'm just curious if buying into skincare is a scam. Yeah, it's very important, actually. Skincare is very, very important if you want to stay young. It's not going to affect your life, right? You're not going to get a heart attack or anything like that by not doing skincare. But if you want to stay young, looking good, things like that, absolutely skincare is very important. In fact, if you have sunscreen on, it'll prevent skin cancer on the face. So absolutely, it's super, super important. Now, it's not regulated, so there's a lot of skincare that is a scam because it doesn't do what it says, but as long as you get on a good regimen and a good skincare brand, I think you're good. Hi, Dr. T, how are you? Hey, so cool, Foxy, good to see you. Welcome. As opposed to saving up for a facelift. They're 2 totally different things. A facelift helps with loose skin. Skincare helps with the quality of the skin. So you're talking 2 different things. You might need to do both. Do people do surgery on positive patients. Most of my patients are positive. I don't have any negative patients that come in. In fact, you don't want to do surgery on negative patients. They're not going to heal well, and the expectation sometimes isn't what they want. I think sometimes they use surgery to make themselves feel better when that's actually not the case. You want to also be happy with what you are and who you are, and then do surgery to put the cherry on top. But if you're already a negative person, you probably actually should not do surgery. All right. Can surgeons deny plastic surgery if you're positive? Positive for what? 7 months post nose surgery, I have a hard bump inside my nostril that won't go away. Is that normal? It can be, yeah. Scar tissue. I always tell patients with nose surgery, it can take up to a year for swelling and things to go down. You're 7 months, you're getting close, but that's perfectly normal. Okay, thank you. My pleasure. Good. Where are you located? I'm upstate New York. I'm in Los Angeles and Miami. Los Angeles and Miami. Great. Thank you. My pleasure. Oh, can surgeons deny plastic surgery if you're actually positive? Absolutely, absolutely. I mean, that's a life. Nowadays it's not life threatening, but you're dealing with blood and stuff, right? I mean, a surgeon can deny you for anything, for any reason. Oh God, you're in California. Yeah, I'm in California. I'm in Miami too, though. I'm also in Miami, so I am back and forth. How about my daughter lost 100 pounds and skin hanging? What do you recommend? She's gonna need head to toe skin removal. It just depends on what bothers her the most. Most patients complain about their chest and their tummy. Those are usually the first places they want, cleaned up. So, West Hollywood. Yeah, I'm technically in West Hollywood, but it's in Los Angeles, California. Got it. What did I say most about? Thank you. My pleasure. I have forehead wrinkles. Want to do something the most natural since I'm 27. Any recommendations? Botox. And how many sessions? Botox you need every 3 or 4 months. How can you prevent face from drooping, from aging? Skincare. Retinol to help thicken the tissue. Lasers and all those things that everybody does for the face will help drooping from aging. Thoughts on facial reanimation due to Bell's palsy? I don't do reconstructive work on the face, unfortunately. I mean, to each their own. It just really depends. Is the Bell's palsy temporary? Is the Bell's palsy permanent? Facial reanimation. Also, there's a high risk of complications and issues, and the nerves not kind of forming. So, are you okay going through all that for something that might not work? There's a lot of ifs when it comes to facial reanimation, and I don't really do those procedures, so I can't really speak too intelligently on that. Is it normal for one chest to be higher than the other? I'm 12 weeks post-op. By then it should have evened out, but yes, it could be a little bit off. And remember, the chest is they're sisters, not twins, right? And so, there are going to be some asymmetry there, but it shouldn't be anything significant. Your skin looks flawless. Do you get Botox yourself? Yes, I do. I actually need to get some. I might do some today or tomorrow, but yeah, thank you for that. Hello from California. Hello, thanks for joining. If you threw a bile mix with tiny drops of blood, what does that mean? That's not my field of medicine, so I would definitely go see a GI doctor about that. Great, I'm having surgery Tuesday next week. BBL tummy tuck thigh. Oh, congrats, man, Amanda. Best of luck with that. Thank you. I was so scared that we'll stay like the bump. No worries. Would jaw surgery and then mid-face and cheekbone implant cause issues with aging? It really shouldn't. No. Okay. All right, so now that we have some people on here, I do want to, before I kind of proceed with more questions, please click that link tree in my profile. Okay, the link tree in my profile has a lot of links to different things. The first one is a consultation. You can book a consultation into my schedule. I do virtual consultations like this. I also do in-person consultations. I also have a before and after Instagram page with all my before and afters that we post multiple times a week. So check that out to see my work. I have a regular Instagram page that has testimonials, before and afters, and some educational information on there. I have a YouTube channel that has a lot of educational information on there, as well as consultation videos and so on and so forth. TikTok for funny things. So click on that link tree in my profile when you guys kind of exit out here and support me on those. There's a lot of information on there, but again, you can also schedule a consultation directly into my schedule there as well. Okay. What's your favorite procedure? What do you specialize in? I do a lot of rhinoplasties and I do everything, but I do a lot of rhinoplasty and breast augmentation, breast revision procedures. Thoughts on mid-face lift surgeries? I think it's great for the right patient, but most patients usually have sagging in the lower face, right? And so usually if you need a mid-face, you need the lower face as well, because the mid-face usually holds on with the test of time. So again, it just really depends on the issues that you have. Hello, doctor. Hi, Camille. Thanks for joining. Microneedling laser won't help with the forehead wrinkles. No, no. Forehead wrinkles like that, that's Botox. That's a muscle action. Thoughts on Medicube products for anti-aging? I've heard of the Medicube stuff. I haven't done it quite yet, but I know a good friend of mine uses that, and she swears by it. So sounds like it works pretty well. But I have no personal experience. Is it safe to do microdose Accutane before rhinoplasty, or should I pause? You gotta pause for 6 months before rhinoplasty. Don't microdose those before surgery. All right, I got banned again. Okay, at least this time it was a little longer. Is it safe to do? No. Okay, what's the best way to help keloids heal? Silicone cream and follow up with your doctor. Can you incorporate a tummy tuck incision into a C-section scar? Yes, in fact, at least I do. I cut out that C-section scar when I do a tummy tuck. So you got a brand new scar. The C-section scar is completely removed and cut out. The tummy tuck scar is below. So here's your C-section. I usually go below the C-section even, and then we cut the whole thing out. What's the difference between Botox and filler? Botox is a muscle relaxer. It does stuff for, it does more for muscle work. Filler, as you know, the name, it does more volume. So Botox is more for movement and action. Filler is more for volume. So two totally different things. What comments are you reading? I'm reading every comment that comes through so far. Is it safe to do microdose? No, I already answered that. Do scars ever fade away significantly? I had my rib cartilage removed 5 months ago, 1 inch scar. 5 months is nothing. It's going to take at least 12 months, if not years, for scars to fade. So 5 months, you're still scratching the surface there. I got my nose done post-op day 5. It's so pointy in my cast. I'm scared. Don't worry about it. The cast is pushing everything together. Look, if I do that, the nose is going to be pointy also, right? Doesn't mean the nose is going to be pointy at the end of the day. So give it some time. Don't freak out. You know, surgery is a process. You got to understand there's no fast or immediate results. It takes time, and you got to be patient. Do you perform rhinoplasties? Could you please tell me the starting price? Yes, I do a lot of rhinoplasties. In fact, that's probably my number one procedure volume-wise. Rhinoplasties it starts at $15,000. Question: I've had my saline implants since 2014. When is the time to change them or replace them? If you don't have any issues with them, keep them in until you have problems. All right, Patricia. Let's see. Last question. I think. Do you have any suggestions to speed up the bloating process? Only thing I can think of is stop the pain meds, you know, and maybe some laxatives, or if you haven't had a bowel movement, that's probably the issue. So stool softeners, laxatives to start getting the bowel movement going, and that should help. Hi, Dr. Tsai, can't wait to get my cast taken off tomorrow. Oh yes, Salil, good to see you. Yeah, can't wait as well. If everything went very well, I'm sure you're gonna be very happy with it. So I can't wait to see you tomorrow to get that off also. Can you get kilos on your face? Absolutely, you can as well. How many days will I need off for tummy tuck? At least a week. I had trouble swallowing after Botox in my lower face, DAO. What non-Botox options are there? I try not to do Botox in the lower part of the face. Botox, eyes and above, you try not to do much Botox unless it's the masseters here. The DAO, if you don't do it right, or if it travels to the adjacent muscles, you're gonna have problems. Like sometimes you get that, you don't want that. So I avoid those. It's not worth the benefit. The benefits are very minimal. So, but now that you've had it done, you basically just have to wait until the Botox wears off. Long story short. Thoughts on lower blood flow plasty? It's a great procedure for the right patients. You know, there's usually the bags you can remove or the skin that you can pinch off. So it just depends on the issues and the concerns. But it's a good procedure. Yeah. What's the difference between? I answered that. Let's see. This is so educational. Thank you for this. My pleasure, Zen Lee Ray. How long to heal from lipo 360 before returning to physical job? If it's just lipo and no fat grafting, a couple days, a week at the most. Oh boy, you're so fine. Thank you so much, CC. Good to see you. I hope you're doing well. Thanks for joining again. When does drop and fluff happen? Usually post-AUG for dual plane. You know, about a month you'll be presentable, but 3 to 6 months for the final drop and fluff. Thoughts on lower blood? Answer that. Do you only have an office in California, or do you have a location in New York, or do you know someone in? I have an office in West Hollywood, California, or Los Angeles, greater Los Angeles area, and then I have an office in Miami as well, on Miami Beach. So no New York for me. I've had chronic allergies. I want to stop taking meds for it. How can I go about this? You need to talk to your doctor, your allergy doctor. I'm a surgeon, so I don't know much about allergies. So you're gonna have to speak with your allergist about that. Thank you, my pleasure. Can scleroderma patients get lip filler? Yeah, you can. Is it normal to what, Hannah? Where can I where can I see before and afters for lipo tummy tuck? Ociela's mommy, click on the link tree in my profile. So click on my profile name up there somewhere. There's a link tree in my profile on my main page, and it's called link tree. So click the link tree one. A bunch of smaller links will come up, and it'll say before and after Instagram. So look at my before and after Instagram page. We're posting new ones up pretty much multiple times a week. I have a whole lipo tummy tuck section. You kind of take a look at that. There's more than you can kind of see on there. And then yeah, if you're ready for a consult, same link, click on the schedule a consult link and we can have a chat. Is it normal to have lumpiness in the axilla area after lipo? Still feel tight after 3 months? I mean, are you talking about this area, like the back area? It depends on what you're talking about, but 3 months is still fairly early after lipo. It can take 6 months or more for some of the swelling to subside and go down. I mean, it shouldn't be super lumpy, but there could be some asymmetrical swelling and things like that that's causing that to happen. The front area, okay, yeah. Generally not, but I wouldn't be surprised also, if that makes sense. Generally it wouldn't be, but at the same time, it's also not abnormal, if that makes sense. My wife wants a tummy tuck. How much does it cost? Most patients who want a tummy tuck generally also need liposuction. So if you truly only is tummy tuck, it's about 12 to 15,000. If you're going to add some lipo to the stomach, flanks, and to the back, then we're probably talking closer to 16,000 or something like that. Hi, doctor. Thank you for responding. I may book a flight to see you in Miami for appointments, consultations. Great, no worries, Laurette. Again, I'm in Los Angeles and Miami, so whatever coast you're on, I can kind of see you in both areas. If you want to see me in Miami, send me a direct message with your name, your phone number, email address, and I'll have my office over there book you a consult. The links in my profile are for my LA office. I'm kind of here the majority of the time. So the ones for Miami, if you guys are interested, just send me a direct message with your information, and then I'll have my office reach out and get you guys scheduled for that, okay? All right, well, it looks like I am done with the questions on TikTok. I think I got banned on TikTok here, so I'm actually gonna sign off. Those of you who are on TikTok, please sign on again. Give me like 2 minutes to kind of close out of this assignment because I got restricted. And so let me kind of sign off and sign back on to hopefully get this restriction off. So let's see. So give me a sec. I'll be right back. TikTok, that is. Instagram, I'll still be back. I got your message there, Jazz. Let me just reset this so I can answer your question as I wait for people to get back on the TikTok here. Okay. TikTok is back on. Great. All right. Jazz Judge, is there anything for dark circles like dermal fillers, PRP, PRFM? So for the dark circles itself, unfortunately, there is, the dark circles just have to do with the pigment under the skin. There's a lot of blood vessels and things in the area that just stain the skin. And so there's nothing physically you can do about the coloration of that. However, if you have an indentation there or if you have volume loss there, you can fill it with filler, PRP, things like that to bring that out of the shadows, okay, if that makes sense.